I'm basically 2 hands, 3 cities, and just a heart for healing. Hi, my name is Dr. Randee Ward. I'm a licensed chiropractor, acupuncturist, and mom. I have over 25 years experience helping people heal naturally. My company's name is Pain Relief Management. I founded it in 2001. I help people, just like the name says, with lasting pain relief. I help people get out of pain through chiropractic and acupuncture by combining both Western and Eastern medicine. Well, I always knew at a young age that I wanted to help people. I just didn't know what career that would be. Am I going to do chiropractic? Am I going to be a medical doctor? And I decided that this was exactly where I should be. I was inspired to enter this field in 1992. I was in college. My parents had gotten in a car accident and I was visiting them. I guess just saw how chiropractic helped them get back to health and get back to their functioning because they were pretty seriously injured. That just inspired me to want to help others and be a chiropractor. And then it was when I was graduating chiropractic school, they offered early continuing education for chiropractors. And I was really interested in acupuncture. And so I took a 100-hour course and it just fascinated me. It just, it's just a unique principle of healing. It's individualized for each patient. It's not just kind of cookie cutter. Prior to starting my business, I have 2 bachelor's degrees, one in anatomy and one in biology. I also attended Parker College of Chiropractic, where I attained my doctorate of chiropractic. I also have advanced training in acupuncture. I attended Dallas College of Oriental Medicine in 2004. I also received 2 U.S. diplomates with acupuncture, one through the American Chiropractic Association and one through American Academy of Acupuncture. Also advanced training, I went to both internationally, China and Korea, studied in Shanghai Hospital. I bought my business in 2001. I ran a successful office in Denton for about 12 years, and then I stepped away to raise 2 boys. I rebuilt my practice from the ground up, and now I travel between 3 offices in North Texas, helping people through chiropractic and acupuncture. What does acupuncture do? They actually discovered cells called telecytes while they were doing cancer research. They were studying how cancer travels. They were looking at the cells that are within the fascia of the body, that whole system. And that is actually where the acupuncture meridians lie within the body, just right below the surface. And these cells actually will communicate, and that's how you can get hormone releases. And you can get cells to change permeability and allow fluid to finally transfer. It helps with the body's natural immune response. It helps with releasing stem cells, firing touch receptors that get to the brain faster, they block pain. It also helps with kind of unlocking that 97% of the brain that we don't use. A meridian is that highway of receptors that actually travel through that organ system. So when you talk about like a liver channel or a spleen channel, you're really not having anything to do necessarily with the actual spleen, but you're dealing with that highway that goes through that spleen. Acupuncture is neurology. You're working with the brain and the whole nervous system and that highway of receptors back and forth, kind of piggybacking on same embryological tissue to get that brain to heal that part of the body. It's very fascinating. They've done PET scans of the brain after applying certain needles, and those parts of the brain that work on that part of the body, actually there was an increase and decrease in blood flow. So I hate calling them needles because they're really like little metal hairs that just sit on end, and they're designed to kind of balance. And the fascia will actually come and stretch towards that needle. And so when you've introduced that acupuncture needle into the body sends its like first line of troops. It's like all the blood flow to that area with all their helper cells, stem cells. But during that process, sometimes it kind of can hold. And so when you go to remove it, it's like the body says, no, I'm going to keep it. We're still using it. We're still healing. And so proper application of removing a stuck needle would just be to maybe let it retain for 5 to 10 more minutes, or stimulating the area around it. And by firing those touch receptors, the body kind of releases it, and then you just take it out. Okay, so what are the key acupuncture meridians? So if you can imagine taking every Western human sign, symptom, manifestation of disease and putting them in 12 meridians. And if you looked at the meridians, they're based on like the 5 element theory. So you look at the primary ones like heart, pericardium, that's the fire element. And then you look at spleen and stomach are the earth element, and lung and large intestine is the metal element, and kidney, bladder, water. Finally, we have the wood element, which is liver and gallbladder. And so these meridians, they were named by the pathways that travel over those organ systems. And there's kind of that whole, I don't know if you've seen the yin and yang, which is like that opposing, like always light and dark, that we're always trying to have that balance. So the 5 element theory is a principle. There are different human characteristics. So some people might be more fire element. They may be more wood element, and it's body type. You can't explain it in one question. It's like, what is infinity? Healthcare is not linear. You have to meet the patient where they're at. You have to go through this journey with them. And sometimes you have to step back and know what their needs are. And you only get that through experience. I don't feel stuck when it comes to a patient. I always have more resources in my bag when it comes to Eastern medicine. I just feel sometimes with Western medicine, there's only so much out there I can do. And with Eastern medicine, I can change my philosophy and principles of treatment, like differential diagnosis, and get the patient back to health. It takes not only brains, precision and skill, but it takes heart. Hearing what they're telling you their symptoms are, but also knowing what their body's telling you. I have a patient actually that I'm still seeing that unfortunately had a stroke and was wheelchair bound. And the outcome was fair, as expected. But through acupuncture and muscle stimulation, he is walking around, tying his shoes, speaking. It's a medical wonder. My patients tell their friends and family. So if you're one of my patients right now, it's most likely is because you heard about me through somebody that I helped. You have to take care of your patient. You have to listen to them. You have to understand them. You have to watch them grow through their healing process, and it's not linear, you know. And there's going to be ups and downs, and know that you can't save everybody, but you can die trying.